What is the tripartite classification of authority and why is it relevant to nurse practitioners? The tripartite classification of authority, developed by sociologist Max Weber, categorizes legitimate political leadership and authority into three types. 1. Charismatic authority, based on the leader's exceptional personal qualities and charisma. Followers are devoted to the leader due to their dynamic personality and perceived extraordinary powers. 2. Traditional authority, rooted in established traditions, customs, and social structures. Leadership is often inherited or acquired through long-standing practices. 3. Rational legal authority, grounded in legally established rules, procedures, and offices. This type of authority is common in modern democracies and bureaucracies, where power is derived from formal positions rather than personal characteristics. Weber's concept of rational legal authority is relevant to nurse practitioners in the context of their practice regulations. Rational legal authority, which is based on formal rules and legal statutes, underpins the varying levels of practice authority granted to nurse practitioners across different states. These levels include 1. Full practice authority. Nurse practitioners can diagnose, treat, and prescribe medications independently without physician oversight. 2. Reduced practice authority. Nurse practitioners can perform certain functions, but must have a collaborative agreement with a physician. 3. Restricted practice authority. Nurse practitioners require physician oversight for at least one element of their practice. Nurse practitioners can find information on their scope of practice for their state by checking with the State Board of Nursing. The State Board of Nursing is the regulatory body that oversees nursing practice in each state. They typically have information on their website regarding the scope of practice for nurse practitioners, including any specific regulations or restrictions that may apply. Consulting with the State Nurse Practitioner Association. Many states have nurse practitioner associations that can provide resources and guidance on scope of practice issues. These organizations often have information on practice laws, advocacy efforts, and updates on any changes to regulations. Reviewing state laws and regulations. Nurse practitioners can also review the specific laws and regulations governing nursing practice in their state. This may involve looking at state statutes, administrative rules, and other official documents that outline the scope of practice for nurse practitioners. Consulting with a legal expert. If nurse practitioners have specific questions or concerns about their scope of practice, they may consider consulting with a healthcare attorney or legal expert who is knowledgeable about nursing practice laws in their state. By taking these steps, nurse practitioners can ensure they are practicing within the legal boundaries of their state and providing safe, effective care to their patients. Congratulations on completing our video on the scope of practice for nurse practitioners. Armed with this knowledge, you are now equipped to confidently navigate the legal boundaries and provide exceptional care to your patients. Remember to stay informed, advocate for change where needed, and always prioritize the well-being of those you serve. Thank you for watching, and here's to your continued success as a nurse practitioner.